do hope and wish that people will do more research, investigate for themselves, and make the decision to get vaccinated. My name is Michelle Etheridge. I'm the Interim Health Director here at the Edgecombe County Health Department, and have been with the county for a little over 21 years. I first heard about coronavirus back in January 2020. We started to have some state calls, and started to hear the buzz about it, and I just remember thinking, what is going on? What are we facing? And is this going to just maybe be something like the flu? Life in public health it's been nonstop. This is what we train to do. This is what we do in public health. And we, ever since the beginning of the pandemic, have just been doing everything we can to provide everything the public needs, ensuring that their health and safety is number one. The biggest thing I've worried about is becoming ill myself and then infecting family members or coworkers. So my concern's been more about other people than myself. Lately we've had a lot of positives, especially in the school system with children, and the Delta variant seems to be the predominant one. So I am a little concerned that it is coming through in a big wave. They're safe, they're effective. We've done a lot of vaccinations, but we've got a long ways to go. People need to make the decision for themselves, but I do think that vaccinations will help to prevent people from getting sick. I am vaccinated. I have some family members that if they were to become ill, it would be very detrimental to their health. And I didn't want to be the reason that they became sick. I didn't want to contribute to that. So I felt like it was the right thing to do for myself and for my family. I wish there was maybe an easier way to explain the vaccine, to the general public, so that they would feel, secure in getting the vaccine and to limit their fears about getting it. I do. We've, like I said earlier, a lot of our providers have worked really hard to vaccinate in Edgecombe County and the surrounding areas, but we've got a long way to go. I really think it's fear. I think it's fear of not knowing, hearing a lot of mixed reviews and messaging out there, some really inconsistent messaging as well, and I think that contributes to their fear. Education, just taking the time to talk with people about the vaccine, educating them, providing them with as much factual knowledge as possible. I think people who have been vaccinated, talking about their experience and trying to ease those fears for others. The CDC is a great website. They have a plethora of information. The Edgecombe County website has some information about COVID as well. Talking to your own healthcare provider and about your current your health and what they recommend for you is a good idea as well. It's kind of like teamwork. We're all facing this pandemic together. We need to come together. We need to educate each other. We need to support each other. And we need to provide resources for those to be able to get vaccinated, as well as have the tools that they need, to protect themselves. I think just the freedom to kind of come and go. We used to be able to just come and go throughout the community, and I miss that. I feel like now we need to be more cautious about where we go, making sure we are wearing our mask and keeping our distance from others, and so that ability to be free to communicate with one another, I miss that. know that the vaccines, they're safe, they're effective, they are available throughout the community, and they're much needed to help us get through this pandemic.